Hi, my name is Dan, and today I'm going to be talking about saffron spice in the treatment of depression. Saffron spice is the stigmas and styles of the saffron flower. Each flower only produces 3 of the tiny little strands. In addition to that, they must all be harvested in the morning on the same day and picked by hand. So it's a very labor-intensive plant to get the stigmas and styles spice that we use for cooking and as supplementation sometimes. So for those reasons, it's sometimes considered the world's most expensive spice. I was able to get a 3-gram tin of it on Amazon for about $16, and I'll go into the studies for depression in a little bit, but at least one study I looked at used 30 milligrams daily, so my 3-gram tin would last 100 days at that dose, and that would come out to about $5 a month. So compared to some antidepressant medications, saffron spice isn't really all that expensive. So how does saffron spice work for depression? So we talked about antidepressants in the past and how they work, usually by increasing certain neurotransmitters like serotonin, norepinephrine, or dopamine. Saffron works differently than that. We don't understand the mechanism completely, but 4 potential mechanisms are in the evidence. So the first potential mechanism is antioxidant effects. So depression causes stress on the body, and as your body uses energy, free radicals are created which can damage cells. Saffron has antioxidant effects which can protect those cells. Next would be anti-inflammatory effects. So again, inflammation happens when someone's chronically depressed, and inflammation can be bad for the brain, bad for the body as well. So by being a chronic anti-inflammatory through its mechanism, that could help with depression as well. The third potential mechanism is through hypothalamus pituitary adrenal effects, HPA Access. So again, if the body's stressed through depression, working with the HPA Access can help treat the depression. And the final potential mechanism is neuroprotective effects. So saffron was shown to increase a substance called BDNF. BDNF stands for brain-derived neurotrophic factor. And you can think of BDNF as kind of like a fertilizer for brain cells. So it helps cell A grow the attachments that it uses to communicate with cell B. So it's a fertilizer to help those growths happen so cells can communicate a little better. So through those 4 mechanisms is the theory of how saffron would work for depression. So I had worked in multiple hospitals in the past and multiple different psychiatric units in different states across the country, and I never heard saffron mentioned once as a treatment. And I understand that there's the liability because it's not FDA approved, so maybe it wouldn't be the first choice to prescribe, but I never even heard it mentioned from an academic standpoint. So when I started reading some of the studies and seeing how it was used across the world, it was really eye-opening for me for what else is out there. I was in my shell and treating people the same way, so it was so interesting to me that there's this evidence out there. The first trial I wanted to talk about was a trial that compared fluoxetine 40 milligrams, so an SSRI FDA-approved antidepressant medication, against saffron 30 milligrams daily for 6 weeks. And interestingly enough, saffron and fluoxetine showed similar response and remission rates in depression. So in this small study with 40 patients, saffron was showing very promising results. It was doing as well as an FDA-approved antidepressant medication. So a second study compared saffron 30 milligrams daily with imipramine 100 milligrams a day. And imipramine is a tricyclic antidepressant medication that's FDA approved. And again, this study showed that saffron had similar response and remission rates as an FDA-approved medication. So we have 2 trials with medications from different antidepressant classes that saffron was faring just as well as the approved medications were. So it was really exciting to read those trials. I also came across there's more studies than that, but I came across another trial that looked at patients on an SSRI, antidepressant medication, and then they were added crocin, which is main constituent of saffron, like a part of saffron, or placebo. And the group that was still taking the SSRI medication with the addition of saffron did 10 points better, over 10 points better on both their depression and anxiety scores. So we have evidence that shows that saffron's just as effective as certain antidepressant medications, and then evidence that shows that adding saffron to antidepressant medications is effective as well. So after reading all that evidence about saffron for depression, I became pretty excited and I wanted to try it for myself. So what I do is I started with just a few strands, but now I take a little pinch of saffron like that. I normally add it to hot water and make kind of a tea. And what you'll notice, a good way to tell if you have real saffron is it turns the water yellow. If it turns the water red, because the pieces of the plant are a deep red color, then it could just be a dyed plant product, like they dyed it red. So additionally, when I was taking the saffron tea, I noticed that my mood got a lot better. So I did notice some differences in my mood, which was exciting to me. And since I didn't have any side effects, most mornings when I wake up, I'll make the saffron tea and have a glass of it. And sometimes if I don't have time for the tea, I'll just take the strands and put them down the hatch. But after hearing the evidence, before you go run out to buy saffron to start to take it, just like prescription medications, there are side effects with saffron and there are potential drug-drug interactions. So it can interact with other medications. The most common side effect that I saw was a decrease in blood pressure. I didn't notice any side effects when I started to drink it, but if you're taking blood pressure medications, it could work together to lower your blood pressure too much. Additionally, long-term studies showed a slight decrease in certain blood counts. So if you have any blood issues, it may be something to be a little weary about. But just like anything, it would be a good idea to ask your doctor if you can start taking saffron. They can do an interaction check with your other medications. They can see what other diagnoses you have and see if it's okay or not okay. So I still recommend going through the traditional route with talking to a doctor before you start to take any supplements. So that finishes my quick review of the literature for saffron spice, and I hope that information and my personal experience was helpful. Thank you.